Hi everyone, welcome to Let's Talk with Dr. J. I am Dr. J. Today we are talking about PAP smears. Now, PAP smears are a screening tool to look for cervical cancer. Most women know what a PAP smear is. Most women have had a PAP smear or more, and most women do not look forward to having them. You're not alone. I don't think anybody enjoys getting a PAP smear. So I thought today we would talk about what they are, what we're looking for, how they're done, and why it's important. So like I said, a PAP smear is a screening tool for cervical cancer. When it comes to healthcare, cancer is what we're always trying to rule out. If you're having pain, if you're having symptoms, we try to rule out the worst case scenario, which quite often is cancer, and then we go from there. There are certain screening tools that are used in healthcare. For women, those are mammograms for breast cancer, PAP smears for cervical cancer. For men, there's prostate exams, colonoscopies, things like that. So we're always trying to stay healthy. That is the goal. Treat things or identify things before they become a problem. So PAP smears start at the age of 21. Back in the day, we used to do them earlier than that, starting when women became sexually active. Over the last decade or so, those guidelines have changed, and now we don't start until the age of 21. From the ages of 21 till 30, a PAP smear is done every 3 years. After the age of 30, we do what's called co-testing, where we're looking at the cells of the cervix as well as HPV testing. And as long as everything is normal, then you can do that every 5 years. So it's not something you have to do every day. It's not something you have to do every year. But it is something that's really important and you really should have done. So the PAP smear is a collection of cells from your cervix. Now your cervix looks like a tiny little donut, and it's the entrance to your uterus. Okay, we take a little brush like this right here. It's not a knife, it's nice and flexible, and we take your cervix, which looks like this little donut, and we just get a collection of cells, and that's all we use. And we do that by using what's called a speculum to open up your vagina so that we can visualize your cervix. And the speculum is something just like this. And it just opens up ever so slightly so that we can see your cervix, which is that little donut, and get our sample of cells. Now, when we do a PAP smear and we are looking at the cells, again, we're trying to look for cancer. And we do that by identifying any abnormal cells. Abnormal cells in a PAP smear can be anything from a recent infection, bacterial infection, yeast infection, something like that, or even just recently having sex. It can show some inflammatory changes in those cells. That's not necessarily anything to be concerned about, and typically we'll just repeat your PAP smear in a year, make sure that's all normal. And then there's also different levels of abnormality beyond just that inflammatory process. And for that, we'll either repeat your PAP smear to make sure things are going back to normal, or you may need a biopsy. Now, once you turn 30, we also start looking for HPV, and that's the co-testing. Now, why is HPV important? There's a lot of talk about the HPV vaccine for our youngsters, and that it can lead to cervical cancer, and that's absolutely correct. HPV is a virus. Like any other virus, there's multiple strains, just like the flu virus, the COVID virus. There are multiple strains. We know that a couple of those strains of HPV can cause changes to the cells on your cervix, and those changes can lead to cervical cancer, and that's why it's important to identify it. So if we see that you have HPV, then the question is, what strain do you have? It is a strain that is known to cause those changes and may lead to cancer, then that's a little bit more serious. If it's an HPV strain that is not typically related or associated with developing cancer, then it's not as serious, but still something that we take seriously and keep an eye on. So with that, HPV, like I said, is a virus, and like any other virus, your body will typically fight that off. So we'll repeat your PAP smear typically in about a year and just make sure that that's happened. Now, what are some reasons why your body may not fight HPV off? Well, there's a couple of them. Some people have a hard time fighting off virus if they're immunocompromised, or if they smoke. HPV loves nicotine, and nicotine does deposit on your cervix and make it harder for your body to fight that virus off. So you have a lot of reasons not to smoke, and here's one more: cervical cancer. So cervical cancer is something that is easily identifiable, usually very slow progressing, so we can find it early as long as you keep up with your screenings. So again, PAP smears start at the age of 21, and they are every 3 years from the ages of 21 to 30. Starting at the age of 30, we do co-testing, looking at the cells of your cervix as well as HPV, and that testing is every 5 years. So it's an uncomfortable situation, it's an uncomfortable test that we have to go through. Thankfully, it's not a test we do every day or usually every year, but it is very, very important. The goal of PAP smears and cervical screening, cervical cancer screening, is to identify problems early and keep you healthy, keep you well, and make sure that it doesn't turn into something bigger in the future. Thank you for joining me. Again, this information is just meant to answer some questions or increase your knowledge or give you something to think about and have an informed discussion with your healthcare provider. But what else do you want to talk about? What would you like to talk about? Message me, shoot me an email, and let me know, and I am happy to discuss your topic of choice on my next podcast. Thanks so much. Have a great day, everyone. See you soon.